Is waxing safe in pregnancy? Considerably, it is safe. But because of the hormonal changes in pregnancy, there can be irritation or bleeding while waxing. So this can cause infection. So be careful, and if you're sensitive, better to avoid. Hair removal creams have a chemical called triglycolic acid, and this causes fetal developmental issues. So it's better to avoid. And laser hair removal during pregnancy, better to be avoided because there are limited studies. So all in all, it's better to go with shaving or epilation. Some sunscreens contain chemical called oxybenzoate, which is hazardous to the fetus and the mother. And skin brightening creams. Well, some of the skin brightening creams contain retinoids and hydroquinones. These can cause developmental delays and birth defects in the fetus. While purchasing shampoos, body washes and soaps, look for these chemicals and avoid them. Phthalates, paraben, diethanolamines called DEA, and triclosans. Hair coloring in pregnancy. Hair colors contain chemicals like formaldehyde, phthalates, parabens, and retinoids. Formaldehyde causes miscarriages, and retinoids is an absolute contraindication whether in the form of hair colors or oral supplements like tretinoin, isotretinoin, and it also is present in some of the skin brightening creams. So retinoid in any form is an absolute contraindication in pregnancy. Perfumes and deodorants. Well, there are two things in this. One is antiperspirants and deodorants. Antiperspirants shut down sweating and deodorants add fragrance. So comparatively, deodorants are better than antiperspirants, and antiperspirants are made of aluminum. Aluminum causes placental abruption, low birth weight and birth defects. So it's a no to use antiperspirants. And in deodorants, look for phthalates and parabens and try to avoid them. It's better to use natural fragrances. Dental procedures are best conducted in the second trimester, that is 4th, 5th and 6th months. Because in the first trimester, there is a risk of teratogenicity as this is a period of organogenesis. And in the last trimester, 3rd trimester, which is 7th, 8th and 9th months, dental procedures can be done, but the positioning and posture of the female might cause pressure on the inferior vena cava, and giving a position is also difficult because of the gravid uterus. Any which way, if there is an emergency wherein the infection increases, if the procedure is not done, we can proceed with the procedure. Especially procedures like dental extraction and root canals can be tried and done in cases of emergency even in 1st and 3rd trimester. Lead and mercury in pregnancy are an absolute contraindication. These are found in large fish like shark, swordfish and large tunas. Commercially available carbonated drinks, mayonnaise, tomato sauce, these contain a chemical called sodium benzoate. This causes DNA damage and further fetal development. So, if in moderation it's fine, but better to be avoided. And the famous tasting salt, monosodium glutamate. It is said that this causes hyperactivity in kids later on stages. So even this in moderation is fine, but not on a regular basis. It's best to avoid artificial sweeteners in pregnancy. Rather, use moderate amounts of processed sugar. Excess caffeine intake also should be avoided. Anything in moderation is fine.